Good morning. Thank you for joining us. Today's health briefing is part of a series of briefings focused on presenting real-time healthcare data specific to vulnerable and at-risk populations in South Central Pennsylvania communities, inclusive of York, Lebanon, Lancaster, Hanover, and Gettysburg. This briefing is presented by Family First Health, a leading regional healthcare organization serving at-risk populations for the past 51 years. Family First Health is a federally qualified health center serving more than 22,000 patients annually. We invite the media and the public to submit questions in the comment section of this video post or by emailing healthbriefings@familyfirsthealth.org. Copies of the video briefing will be made available online at familyfirsthealth.org shortly after the briefing. We will begin momentarily.
Welcome to another installment of Community Health Briefings. I'm Jenny Englerth, and I'm President and CEO of Family First Health, a community health center focused on improving access and outcomes in family medicine for all members of our community. Community Health Briefings allow Family First Health to share current and vital health information with a broad audience. Today, we'll focus on an issue near and dear to my heart, an issue that's touched me personally and professionally across my 20-year career in community health. So let's jump in. Annually since 1988, December 1st provides an opportunity to pause and reflect on the impact of HIV/AIDS locally and globally. This day also allows us the space to share current information and relevant to testing and treatment of HIV locally. So on the eve of World AIDS Day 2021, Family First Health has brought together a great panel to share their expertise and experience related to HIV/AIDS. We're going to get started with a few slides before I introduce the panel to level set with some information specific to our program, Caring Together, which focuses on HIV care, treatment, and testing. So testing is the place that we're going to get started, and we test in a variety of settings. We test for HIV within our family medicine practices routinely, and then in community events and regularly in our George Street Center office located in York City. You can certainly see the impact of COVID in 2020, where we had to suspend some of that testing, but annually offering many opportunities for testing to community members. And we've ramped back up in 2021 to allow us to continue to offer more testing even in the COVID environment. Next, we'll highlight the number of individuals that take part in our program. Again, our program Caring Together provides services that we'll share some more details around in a minute, but you can see that number has grown slightly, but has grown over the last 5 years to include 625 individuals across our region that are benefiting from the care and treatment provided through Caring Together. One of the health outcomes that we monitor and measure that's extraordinarily important to folks with HIV and the community at large is called viral load. And one of our panelists is going to be providing more details about the importance of monitoring viral load. But I just want to take this moment to highlight that a national benchmark of Ryan White-funded programs across the country strives to reach 87% of their patients achieving viral load suppression. We have met or exceeded that benchmark through our programming historically, and are very proud of our patients and providers and their work together that allows us to allows 90% of our patients to exceed that national benchmark of viral load suppression. Another data point that helps us understand how people are accessing care and engaging in care, and so able to benefit most from treatment that's provided, is visit frequency. So the national recommendation for folks with HIV is there be at least one visit every 6 months. And we've remained remarkably steady even through a pandemic, with about 77% of our patients reaching that 70% of our patients exceeding that national benchmark of 71%. And then lastly, we'll refer back to this, just information about getting tested. So we'll talk more about this, but we do have opportunities at our George Street Center, across all of our primary care sites. And then there are options for effective HIV testing at home. And again, we'll get into some more details. So now I want to welcome the rest of our panelists. I'm really excited to have them join this morning. Dr. Tomey is a primary care physician with Family First Health, who also includes the care of HIV patients within her primary medicine practice. Nicole Buchanan is our lead case manager for the Caring Together program. And Julio Rivera is a participant in Caring Together, who's joined us this morning to share his experiences. So good morning, everybody. Great to have you with us. And we're going to jump in with Nicole first, and give you a few minutes to describe Caring Together, the programming that we offer, and the impact that the whole team in Caring Together makes on a daily basis.
Sure. Well, thank you for having me. So Caring Together is a program here at Family First Health. We are here to support individuals that are diagnosed with HIV, keep them engaged in their medical care. So we have a large, wonderful team that consists of 5 medical providers. We have 5 case managers. We have an eligibility specialist here to help with insurance needs, a data analyst. We have a linkage to care coordinator, just helping individuals that may be lost to care, getting them back in. So we also have our clinical care coordinators that work with our providers as well. We also have a pharmacist on our team as well. So our biggest goal, obviously, is to keep individuals engaged in care. So offering case management services is very important. We are here as a support for our clients, and we are able to also assist with housing needs, if they have any transportation needs, also food insecurities, we can also assist with that. And again, just coordinating medical care, any way that we can, and community resources. So it is a wonderful thing that we have. We work well as a team. I think the team really just helps our clients feel supported, and that they can, stay in care, and, any needs that they have, we are just here to support them as best as we can. With our patients, we have about 172 that are enrolled in case management right now. So it's offered to any of our clients. As soon as they are enrolled into our program, they will meet with the clinical care coordinators, the insurance specialist, one of us as the case managers to introduce case management. And if they feel that they need case management at that time, we can enroll them and help them in any way that they need. So it's a great program.
It is. It's one I'm very proud of, and one of the many services within Family First Health that makes a difference and impacts people's lives positively. I wanted to just offer a clarification. So case management and all the supportive services that are provided are applicable to everyone or available to everyone, but it may be at certain points in time people don't need those services or don't need the intensity of services, but medical care is kind of the baseline, right? So that over 500 individuals that participate in our program broadly are those that benefit from medical care and treatment on a regular basis. And then case management can kind of come in and out as folks need those additional supports as they travel through life.
Absolutely.
Thank you. Dr. Tomey, I'm going to flip over to you for a minute as we talked about that kind of baseline as being primary medical care that's being offered. And I'm always curious because HIV care is not something that every family medicine trained physician chooses to include in their scope of services. So can you share with us a little bit about why you made a decision to pursue additional education to be able to support this part of our patient population?
Absolutely, happy to do that. So HIV AIDS impact has really always been part of my medical career journey. At the earliest time, there was a pivotal story, experience I had as a really small kid growing up in Western Africa. I had a stomach bug and had to be moved into my uncle's house. My uncle was a psychiatrist at the time. I had to be moved into his house to get some IV fluids and IV medicine. And right there in his house, in the adjacent room to mine, my aunt was there and she had HIV/AIDS. And at that point, she was at the terminal stages. Back then in Nigeria, where I grew up, we didn't know a whole lot about treatment. So she had gone from spiritual house to spiritual house, doctors' offices to doctors' offices, and at that point, she was essentially dying. In another room next to mine was another aunt with cervical cancer. So this whole experience just helped me see more like a wide breadth of medical care. And I knew that wherever my career took me, I wanted to be able to provide that breadth of medical care. So that's kind of what my introduction into primary care, family medicine was to start with. It was part of a lot of my medical school essays, just that experience. However, it kind of remained in the background because in medical school, there was not a whole lot of training specific to HIV care until I got here to York and I got to shadow at Family First Health as a resident. So that was kind of my introduction into Family First Health. I got to shadow case management. And I saw an interaction with a client where they were addressing the housing needs of that client. And if there was any such thing as an ideal care, that was it. Being able to provide not just the medications, not just medicines, but being able to address other issues that can cause instability or can make it difficult to engage in care. So where the case manager at that time was able to help that clients get rent money. So that was kind of like my first introduction, and it kind of solidified my interest in learning more, expanding my training to be able to provide that care. So I knew one way or the other, I'm going to find my way to Family First Health to be able to to learn more about this.
Well, we are better off because of that. So, and thank you for sharing that impactful story of your early life experiences that has obviously guided your career. So thank you for that. I'm going to give it just a second. It looked like Dr. Tomei cut out. We're going to give her a second to rejoin. We're going to give her a little more time, and we're going to shift over to Julio. I'm glad it was at least at a breaking point, and I'm sure she'll be back in just a second to join us. So Julio, thank you for joining us this morning. We're really pleased to be able to add the voice of someone who's living with HIV and the opportunity for you to share your experience. And I want to ask you to kind of start with that testing story. One of the things that we want to support today is people understanding their testing options and to take control of their health in one aspect today by pursuing testing. So can you tell us a little bit about your story and that early testing experience?
My early testing, what I experienced was I was in a program at the time, residential. I wasn't feeling well, wasn't feeling good, stay in bed, weak, tired. I had diarrhea and everything. I had a lot of side effects going on. So one counselor came and told me, would you like to get tested for HIV? And I said, yeah, sure. Why not? I thought I didn't have it. I was like, yeah, okay, whatever. I get tested, and a few days later, I get a phone call from the doctor stating that I'm positive. So I'm nervous, sitting there nervous, turning pale, and when he told me that obviously I pass out and I come to again, the doctor's telling me, you're positive and everything. And at that time too, me using drugs and everything didn't really help a lot because it wasn't me. I wasn't getting better. I was getting worse. So I came into the conclusion that I had to come and get myself back on my feet and get move on and take my medicine every single day to become undetectable, which I am. That was in 2007. And now look at me now. I'm healthy, I'm good, and I'm happy. But the doctors, that treated me, took care of me, and helped me out through the process. It's not easy, but you will get better. It will get better.
Thank you for sharing that. And I'm going to uh, pick back up with Dr. Tomey in just a second. So she has the privilege of being able to be part of your team right now. You've obviously had interactions with lots of great medical providers who have worked with you through the years. But Dr. Tomey, when you think about your experience treating your patients, Julio is one example. What are those things I think about? We talked about viral load on one of the slides and engagement. Can you give us some framework why those indicators are important and why we monitor those? It's obviously top of mind for Julio, so he knows this is an important indicator for his health. Give us a little more background so we all understand why those measures are important.
Thank you. So the care of patients living with HIV has thankfully evolved a lot over time. Now we have a lot of treatment, and the goal with treatment is to keep the amount of viruses, HIV viruses, that the person has in their bloodstream to a minimum level, to a very low level, such that the body's immune system is able to work properly to fight off infection. So I'm going to back up a little bit. What the HIV virus does is that it kind of just hijacks the body's immune system to make copies of itself. So people can have up to thousands, millions of copies of the viruses in their bloodstream, and that makes their body unable to fight off other infections and other illnesses. But what the medicines do when people take their medicines and stay on their medicines, what they do is that they reduce those virus copies to really, really low levels. So the studies show that many times when those levels are really low, typically less than 200, not only is the patient able to live a long, healthy, full life, they're also very, very unlikely to spread it to others. So there was a lot of landmark studies that show that it's undetectable is essentially untransmissible. It's almost impossible to give it to a sexual partner, to give it to a family member, to give it to a pregnant woman, giving it to a child. It's almost impossible to do that when those viral loads are really, really low. So not just is there a benefit for that person, the patient themselves, to be able to live that long, full life, there's also benefit for everyone around them, their significant others, their family members. So it's a whole level of safety when we're able to keep those viral loads low. So if you say suppressed, undetectable, it's kind of what we're referring to.
And I think that then ties back to some of the national and global campaigns we've been seeing, where we are seeing the end of this epidemic. Right. Potentially. So that's pretty exciting for those of us who have had the experiences that you had as a young child, others of us who have had experiences over the years, to think that we could feasibly in our lifetimes reach a state where this is not an issue that we are seeing surface for folks.
Absolutely.
So Julio, when you are thinking about your care and treatment and all that goes into that, what are those things that are kind of most important? What keeps you going? You've talked about a lot of volunteering that you've done over time, and that level of engagement's important. How do you keep that going, and what does engagement mean to you?
Engagement means, well, for me to get to know the people in my surroundings and everything. I always in I always like to volunteer, help people out, reach out to people, to get tested, get prep. Um, it keeps me motivated, keeps me wanna live more, be more healthier, and move on with myself. Um, helping for me, helping people, it's a great thing. It's a great feeling, and it also makes me feel good about myself. That I'm happy that I'm taking my medication every single day and moving forward and to pursue the dream that I want to become an HIV peer counselor. And that's my dream and that's my goal and that's what I'm shooting for. And to help people out there because I know it's not easy to remember that pill every single day to take every morning. Sometimes you forget. And as long as you take it that day, I mean, you'll be okay. And as long as you're undetectable, you'll live longer and you'll live a nice, healthy life. So it's very important to take your meds every single day. And helping people, it's a great feeling. I mean, I love my life. I have a great partner, and he sticks by me. And he's by my side all the time, and I'm happy for that.
You talked about a few support people in your life, and I think your mom is one of
Oh
those
yeah,
as well that
my
we heard.
mom. My mom is supportive. My sister, brothers, they know the situation. They stick by me. My family is behind me 100%. They know my situation.
It's great, so important.
Yeah.
Dr. Tomey, when you think about engagement, what are some of the challenges you see your patients have with engagement? Because this is a chronic illness at this point. So you travel with people through a significant portion of their lives, and it's not easy. As Julio said, taking a medication regime is not an easy thing to do, and things happen in life. So what would you say to folks about engagement and the importance of that as we think about HIV care?
So it is certainly challenging, like you've all alluded to. Um, when I meet people in my practice for the first time, a lot of that first visit is really trying to understand where they're coming from, to understand their stories, not just to know how to treat, but really just we're meeting another human being. So understanding those stories, where they're coming from, what their joys, their hopes are, what the potential barriers are. And going into your question, sometimes people want to be engaged, but they have other issues going on. They have housing challenges, the homelessness. They have there's the fear that especially at the beginning is a lot of what is going on with a lot of people. There's fear of death, fear of if they will be able to continue with this. There's sometimes also other things like substance use, which kind of becomes a distraction. There's people moving from place to place. So there's typically a whole lot going on when we are meeting people. And part of that first meeting is understanding those things and understanding how we can come around and support. Another major challenge that I see, which I'm glad that Julio, had that support, is that a lot of our patients don't, because of the stigma around HIV, they really don't want to tell anyone, and it's kind of like a really isolating experience. And sometimes that very fact that they feel like they're walking through this journey alone makes it hard to stay engaged. So those are the when we hear those stories, when I hear those things, we are able to try to form a plan to part of that plan is helping get housing. Part of that plan is, do you want your parents to come so we can all talk about it together? Part of it is just working with the patient to try to address whatever it is that would be a barrier to engagement. And whenever we can get family members supporting, it's a great thing. But when we can't, the team does the best we can to provide that layer of support.
Thank you. And sometimes that just takes time, right?
Right.
And that's part of meeting people where they are. They may not be ready to engage their family today, but maybe
Right.
in 6 months they will be. As you said, that's an important component, and really for management of all health issues, right?
Right.
To have a strong support system, however that can be created for people.
Right.
Thinking about testing specifically, Nicole, I wonder if you could tell us a little bit more about what testing looks like. So sometimes people are hesitant to get their blood drawn, or don't, are a little afraid of the process. And then in this process, there's a whole other host of fears and stigma that might be attached. So could you walk us through the really practical, like what is it like to get tested?
Sure. So we offer free rapid HIV testing here at our office at Family First Health on the 3rd floor. All of us in the program are trained to administer the test. So it's just a walk-in. You don't make an appointment. So patients just stop in, ask for a test. So any of us that are available are able to come take that individual back into our office space. We have a lab here in our office. So the test is really simple. It is a very small finger prick, just as if you were testing your blood for diabetes. We need a small amount of blood. Simply do that test. It takes about 15 minutes to get the results of that test. So typically, the hardest thing I think for individuals is the fear, and that 15 minutes is a very long 15 minutes. We usually have individuals, they can sit with us in the lab, or we can have them sit and, kind of wait in our waiting area for the 15 minutes. But that is the biggest thing when we come back out and bring them back to give them their results. They are just so scared and so nervous. And then until we give them that result, it's like a sigh of relief. It's very simple. So, we do a lot of outreach events, and at our outreach events, if we're able to, we bring our test kits. As long as the temperature is okay outside, we can provide the test outside. If we're in an indoor event, we can do the test. Again, it's confidential. So we would just take one individual back, do that test. Those results would only be given to that individual. We can also provide a little paper saying that you were tested today and your result. We do not consider it positive or negative. We say non-reactive or reactive in our tests, as it is, it's a rapid test. It's not confirmatory. So it's awesome that we are able to provide that test. There are also at-home test kits that you can provide and get free, and they will get delivered to your home. So if you are nervous and don't want to go out, because I think a lot of people, again, with the stigma, maybe they don't want to come in and get tested somewhere because they're scared and they're nervous. So there are test kits available online. I believe it is www.getmyhivtest.com. So again, that would get delivered free to your home. And so if you're more comfortable with that, that's a great option as well. But we are here to support you. We also, provide some safer items here in our office for free for the community as well, to come in just to, practice safe sex as well at home. So, yeah.
Thanks, Nicole. And we'll have all that information about how to access the free home test kits and the testing that we offer at Family First Health in New York City. We'll make that available through our website and in follow up to this community health briefing. Options are important, right? Whatever works for anybody at any point in time. The point is that we would really encourage folks to be tested. And that's actually the last words that I'd like to turn over to Julio to share some thoughts about for that person who may tune into this or may see this in a few days and who's feeling hesitant about getting tested or is worried about their health in relation to HIV/AIDS. What would you say that might motivate them to take control and get tested?
I would say to them, the best thing to do is to go get tested, and you also use protection. Because you never know, that person might not tell you that they're positive, and you believe them and you sleep with them, you wind up being positive also. So it's also good to get tested. And if you're negative, not positive, you could get on PrEP and you could prevent that. So it's very important to get tested. I mean, it's okay to be scared, worried, because I went through all that. I was scared, worried, how my family's gonna think, what they're gonna think when I say I'm positive, and all that. And that does play part of it. But the best thing, it's just the right thing is to do is to go and get tested. It's very important. It's very important to get tested right now.
Thank you.
Mhm.
It's another piece of information, a very important one about our health. And at Family First Health, we encourage folks all the time to know as much as they can, and then from there make decisions. And but you have to have the information first. And so
Mhm.
sometimes it's our own fear that's the biggest thing that's getting in the way. So I thank everyone for all of your insight and information today, and really appreciate your expertise and your personal perspectives that you shared in helping us share these messages with the community. Family First Health does have several events in recognition of World AIDS Day planned. Today will be at Central Market in York. And come out, talk to us, talk to our team, and enjoy Central Market. We'd love to see you there. And then tomorrow, December 1st, we will be offering free testing all day, 9 a.m. to 3:30 at our George Street Center office. And again, more information will be available on our website. Thank you so much for joining us this morning. Take care, everyone.
Thank you.
Okay. Bye bye.
Thank you.
Thanks. Yeah.